Hi, welcome to Comments on Psych Meds by a Psychiatrist. I'm Dr. Ankur Saraya. If you haven't read the listened to the intro and disclaimer videos, please take a moment to do so. And today I'm going to talk about Buspar, generic name buspirone. So this is a medication that is approved for the treatment of various anxiety disorders. But I would say that it's probably most commonly used, at least in my practice, as either an add-on for depression or in a somewhat unique aspect of buspirone. It can help with the sexual side effects that can be caused by certain antidepressants, the SSRIs, SNRIs. And for certain people, the buspirone can be quite helpful. So again, to reiterate, buspirone is used as a treatment for anxiety, as a booster medication for depression, or in some cases to help alleviate sexual side effects that can be caused by certain antidepressants. The usual dose range, buspirone has a fairly broad dose range. Generally, we start titrating it slowly at 7.5 milligrams, but I like to get my patients up to at least 15 milligrams twice a day. And I have had one patient in particular at a quite high dose, but generally the top range is considered 30 milligrams 3 times a day. And that's been in my experience. I'm actually not sure what the package insert describes, but that's the general top and bottom range. So as I said, I like to get patients at least up to 15 milligrams twice a day. But when using it for sexual side effects, sometimes you can get away with once a day. And I actually have a small number of patients who use Buspar on an as-needed basis, but that's not supported by the research. But like I said, I have a couple of patients who feel like it helps with their anxiety kind of as taken as needed. But following what is understood about the medication, you do need to take it daily for it to work for any of the indications that I described. But again, some patients with anxiety do use it as needed, and a few patients say that they can use it as needed even for sexual side effects. But that's unusual. Generally speaking, this is a medication that you take on a regular schedule. The general bottom range is 15 milligrams twice a day, all the way up to 30 milligrams 3 times a day, although I have had one patient who, through a miscommunication, ended up taking an even higher dose, which she tolerated very well and actually found very helpful. But I will generally not go above 30 3 times a day. And in part, that's because for anybody, taking a medication 3 times a day is hard to keep up on any kind of long-term basis. Coming off of Buspar, generally speaking, it is not a medication that's associated with any kind of withdrawal. You can come safely off of it pretty rapidly. But as a general rule, with almost all medications, I like to have patients taper. So if you, even at 15 milligrams twice a day, I will advise that patients cut the dose in half and do that for a week or so and then stop. But it generally is not associated with any problems. In terms of side effects, this is one of the appealing things about buspirone, is that it is a medication that is generally free of side effects and has no medication interactions. So it's very simple to prescribe and to use. The one thing that a small number of patients experience is that they will experience a bit of lightheadedness about 40 minutes to an hour after they take their first dose of the day. That's generally something that goes away pretty early on as your body gets used to it, and some patients don't even notice it. especially when we start at 7.5 milligrams. But starting at 15 milligram doses, sometimes people experience a mild dizziness, a lightheadedness. It's not terribly unpleasant, and patients have told me that once I warned them that this is something they might experience, it actually was not a big deal at all, lasted for a few minutes and passed. And like I said, once patients have been taking the medication for about a week or so, that doesn't keep happening. So I think overall, I think it's a really good option for the three things that I mentioned. It's not used a lot for anxiety. I think we have other medications that are generally we turn to first. But for patients that are very concerned about the sexual side effects that you can get from SSRIs, and their anxiety is not crippling, I think Buspar is a good first option to consider. I think it's an excellent option to consider for wanting to boost the antidepressant effects of antidepressants, especially if there are sexual side effects, because you can kind of get 2 for 1. You can both boost the antidepressant effects, but also alleviate sexual side effects if they're present. So that's it. Thank you for listening.